Okay, if you've been dealing with some stubborn knee pain, I'm going to show you the most common exercises I prescribe to my patients and pretty much in the order that I do so. The one thing I like to start with all patients who have knee pain is some form of what's called extension. This is our ability to fully lock out and strengthen our knee. Not to confuse this with hyperextension. That's when you accidentally do it when you're running or cutting or something, traumatically happens. What we're going to start here though is placing our heel on the ground, toes pointed up, and our hands in a web. We're going to push just above our kneecap down to straighten our knee. I'm not pushing into my kneecap. I'm pushing down towards the ground. We're just going to do 10 reps on each side here. A good reminder too, if you guys are doing this program and following along, I want you to do multiple sets, so feel free to just pause it. I'm going to make things a little shorter and try to keep this under about 5-6 minutes. So I'm pretty much going to do one set of all exercises. But all you're doing is pushing till you feel that stretch behind the knee and coming off it. Think of this as a mobilization, nothing more. Do not push into any pain or pinching. I'm also going to show you a more advanced version. What you're going to need is a booty band. I'll show you up close here, or any sort of connected resistance band will work. You're going to slide it just above your knee, placing your foot now on an elevated surface, whether it's a chair, a bench, a couch. You're going to use your opposite foot hooked into that band to now press down and mobilize that joint into extension. This is a way to increase the force. It's also an easier way to help out without having to use your hand. So maybe some people might find this easier. For others, this is a more advanced version just because we're able to produce more force into that joint. So just like the other ones, you're going to push down till you feel that stretch in the back of the knee, and then you're simply going to stop. Let's do 10 reps or so on each side. And a reminder, feel free to pause this at any time and do more reps. I'll let you finish this side and we'll get into the next exercise. As we wrap up extension, you're going to need some other equipment. I like these carpet sliders and these mini resistance bands for what we're going to do next. The next big focus is what's called knee rotation. So our ability to rotate our tibia in relation to our femur. So you're going to start by putting your foot on that carpet slider, and realistically a towel works as well, but you just need something you can move back and forth on that you're not going to catch the carpet. So think about moving your shin in and out. As you see, I'm kind of keeping my hands there to stabilize so I'm not moving through the hip or my low back. The ankle can help some, but you're going to feel this in primarily your shin because it's working. And then also your hamstrings are going to be feeling this as well. So as you see, I go to my left knee here. I have a little bit more of what's called internal rotation. That's my foot moves in versus external rotation. So hamstrings are going to be working pretty hard and you will feel some in your shin, but try not to make the whole movement come from just your ankle. The other variation, now we can take our mini resistance band. This is only going to focus on external rotation. The internal rotation setup is a little tricky, but now we can load that joint in a more advanced way with some resistance. You can go both feet at one time or both knees at one time, or you can go single leg, whatever you're most comfortable with. We're shooting for about 8 to 10 reps here for a couple sets, but notice I do have my hips move a little bit, not the best on me. Sometimes I'll squeeze a yoga block in between. But your focus is just to move from the shin. So if you put your hand on your shin, you should feel that thing rotating back and forth. All right, we're moving into our last range of motion I typically train. This is knee flexion. Now I'm starting with a little more of an advanced version. This is called a knee over toe lunge or knee over toe split squat, whatever you want to call it. I'm trying to bend my knee as far as I can over my toes. My heel pops off the bench just a little bit. Now if you've got painful knees, you might not be able to move as far as this. You might just be able to move all the way up until pain and then come off of it. Like I said, I'm starting with a little more of an advanced version, but I'll show you a beginner version here in just a second. So you're pushing forward, full knee flexion, calf is fully touching the hamstring, and then we come on off that. You can also use weights for this. Some people can use a resistance band for added tension. I'm just going to do a few on my left side here just so you can see the ankle pronates a little bit, heel barely pops off. Some people have to go up on their toes. That's more of a ankle dorsiflexion issue, which we can touch on, I think, in another video I might have. So a couple more here, and then I'm going to show you some regressed versions that we can go from the ground. Okay, so here's a little bit of a less intensive version. You're in a half kneeling position. That way you're not up on a bench putting more force over that knee. You can put a little more weight on that back leg, but the same principles apply. You're trying to get that calf to touch your hamstring as you push forward. Knees go well over the toes. Ankle might pop off the ground a little bit. One more version I have is a double leg version. This is just called like heel sitting. For some, this might be very intense because now we don't have the assistance. We're trying to use just our quad muscles. So you can call this a more advanced version, or you can call this a more regressed version depending on where you're currently at. But same thing, kind of touch pain and then come right off it.